This is the training for the Cranex Novus E.
We'll start with the general overview of controls and then show you positioning on a patient. You have a touch screen here to select whether you're going to do an adult pan, pedo pan. You'll notice the KV changes just by selection of the program. If you wanted to overrule that, you can up it with the plus or minus. You also have a joint image here, and there is an optional extraoral bite wing program that you can get on this unit. The T button here is nice. It eliminates all the radiation. You'll notice all the numbers go to 0. This is very handy for patients that have high anxiety with taking pans. It moves and sounds like it's taking a pan with no radiation. Once you've done that, simply touch T again. It turns your radiation back on. Make sure you have your program selected. The controls on the side of the machine, we'll start at the top. There is a light bulb button. This button turns your laser lights on or off. You have a mid-sagittal line, a Frankfurt plane light, and a canine light. They turn off every 30 seconds. This light bulb button would simply turn them back on. Next, you have an up and down arrow. They do exactly what you would expect. They move the machine up and down. And lastly, you have a reset button. It looks like an arrow going in a 3/4 of a circle. This puts it in the patient in position. Hanging on the side of the unit is your exposure button. You may also have a wall switch. For your Nasion support, it moves up and down freely and pushes in freely. You must push the button at the top to slide it towards the mirror. You always want to start with this all the way towards the mirror before you put a patient in. The temple supports are adjusted by this knob here. You want to make sure those are all the way open before you put a patient in. At this point, we'll show you positioning on a patient. You'll have your patient step close to the unit and grab the handles. You'll place your foot just below the bottom of this V so that the patient can step up till they hit your foot. Have your patient take her chin off the chin rest. Look straight ahead. We're going to set this chin rest at the crease in her chin. Place your hand on the patient's back. Ask them to pull into the unit so that you get the collarbones close to this bar. Okay. If the chin rest is a little high, we'll simply bring it down, lift the bite stick, ask the patient to come forward, and close lightly on the stick. Their teeth will fall into the grooves. The patient's going to see a line down the center of their face. Ask them to get that in the center of their philtrum. Don't use somebody's nose. Noses tend to be crooked. There's a little silver tab on the left of the mirror. This sets the light on the bottom of the eye socket here. Hold the back of your patient's head lightly and lower their chin until your light is at the top of the tragus. So your infraorbital notch to the top of the tragus. Lastly, ask your patient to smile big and make sure that this light is touching the maxillary canine. At that point, bring your Nasion support in, lightly touch the patient, close your temple supports, ask your patient to close their lips, swallow and hold their tongue to the roof of their mouth, and take your pan. Thank you very much. This has been your training on the Cranex Novus E.